Have you ever felt your heart race as soon as you step into a doctor's office? Ian, a healthy guy in his mid-30s, finds that his blood pressure skyrockets whenever he visits his doctor. Now, this phenomenon is known as white coat syndrome, and it affects as much as 20% of the population. I'm going to share some surprising research and how to help you tackle those nerve-wracking medical visits head-on. Hi, welcome back to session. I'm Paige Pradko, an anxiety and OCD specialist, and on this channel I support people with anxiety disorders, health anxiety, and OCD. As an anxiety specialist, you can imagine that I have had many clients with white coat hypertension or white coat syndrome. It occurs when a person's blood pressure readings are higher in a healthcare setting than at home. Now, the spike often occurs due to their anticipatory anxiety related to medical visits and possibly inaccurate blood pressure readings and potentially misdiagnosis of hypertension. White coat syndrome is diagnosed if a person's blood pressure on at least 3 different clinical readings is greater than 140/90, and at least 2 home readings are under 140/90. Without other risk factors present. Now, medication is not typically recommended for patients with white coat syndrome, yet it creates uncertainty and excessive worry in people that experience it. Now, Ian worried obsessively about it and, even avoided going to his doctor because of it. So Ian and I decided to try some experiments of our own. We decided to mimic his experience in visiting his doctor's office. I borrowed a white coat, put a stethoscope around my neck, and I greeted Ian in the lobby at his next appointment. Once he was in my office, I asked Ian if I could take his blood pressure. It was only slightly elevated from his normal readings. But we then practiced diaphragmatic breathing exercises, long exhales. We practiced progressive relaxation, and Ian's second reading came down slightly to his normal range. Now, this was not a controlled experiment by any means, and we wanted to see if we could induce Ian's anticipatory anxiety and then see if activating his parasympathetic nervous system and lowering his heart rate could help. Now, our little experiment could not quite mimic the anticipatory anxiety or panic response he felt in his doctor's office, but he did experience a small, though insignificant, decrease with stress reduction exercises. However, when researching this topic, I came across research by Bloomfield and colleagues in 2017 that suggests that having general anxiety is not the trigger that elevates blood pressure for people with white coat syndrome. It is the anticipation of not having a good blood pressure reading, but the fear of their doctor will, interpret the reading and what it might mean about their health and whether or not they'll be placed on a medication. Now, in their research, anticipation ranked higher than anxiety itself. So this might be why Ian and I were not able to duplicate the higher blood pressure readings that he experiences in his doctor's office. Now, Bloomfield and colleagues considered the mechanism of white coat syndrome to be due to a conditioned reflex or response that, once established, persists for visit after doctor visit, year after year, even when the fear of adverse finding was eliminated by repeated examinations over the years. The white coat syndrome or response persisted. A conditioned reflex means that the anticipation and the experience of having one's blood pressure taken is wired or paired or associated with the environment, a medical setting, and the patient's fear response. Therefore, the medical office, the lobby, the exam room, the blood pressure cuff, maybe even the thought of those things can trigger their fear response. Now, as an anxiety specialist trained in exposure therapy, I understand how to create exposures to foster new neural pairings that can override the old fear network. But the problem is you'd need to do a lot of exposure work in multiple medical settings. And if that was accomplished, the new safety learning would fade without that continued exposure work, at least at some interval. So it also makes me wonder if fear is extinguished for someone that has white coat syndrome, if they were, let's say, they were to be hospitalized for an extended period of time. My guess is that it would be extinguished, but it would return when they were no longer in the medical setting. Now, it also makes me wonder if virtual reality devices might be helpful if someone wanted to do frequent exposures to recover from white coat syndrome. Because this is such a challenging problem, what I tried with Ian was not going to help him, and it was not a solution. This is a conditioned response, and while exposure therapy can help, the logistics of doing that therapy is challenging. If you're affected by white coat syndrome, what can help is understanding that this is not your fault. It's an automatic wired reaction in your brain. Understanding why it happens is important. It's a neural connection to fear in your brain, and it's the same thing as having a fear response to being with a tiger in a cage. But for you, it's connected to having blood pressure reading in a medical setting. So this connection likely formed the first time that you experienced a fear about your health in a medical setting. Now, it can be reassuring to understand that white coat hypertension reaction is a conditioned fear response, as opposed to being an indication of a potential health problem, given that there's no other major, health concerns. You will want to speak openly with your medical providers and inform them that research on white coat syndrome has shown that it's a conditioned response. Most physicians, if they're unfamiliar with your experience with white coat syndrome, they might ask you to take your own blood pressure readings at home in a relaxed environment, maybe a few times a day for a limited period of time. And then you share your readings with them in order to keep an accurate record. Now, white coat syndrome often occurs in people that are prone to health worries and health anxiety. Although you will want to follow your provider's instructions, you don't want to begin compulsively checking your blood pressure at home, as that behavior is only going to make your health anxiety worse. So understanding how to treat health anxiety can help you eliminate any other safety and avoidance behaviors that may be exacerbating your health worries. If you need help with health anxiety, I have therapy resources and programs at pagepradco.com, and I'll leave you some helpful links below. Until next time, I'll see you in session. Take care. Bye-bye.